Thank you for attending today's Public Safety Committee hearing on the 2021 proposed budget for the Department of Public Safety, Division of Police, Division of Fire, and Division of Support Services. I would like to thank Council President Harden and my council colleagues for attending this afternoon's hearing. While Mayor Gensler and this council continue to work towards meeting community demands to provide a diverse emergency response, we must invest in our public safety forces to ensure our neighborhoods, residents, and visitors continue to receive an efficient and effective emergency response. This has proven to be a difficult year as COVID-19 has caused staffing shortages, changes to policy, and the heightened risk of infection for vital public safety personnel and their families. I want to extend a heartfelt thank you to all of you for your continued sacrifice in serving the residents of Columbus. Today, Deputy Director Dan Giangardella will give an overview of the budget process for the Department of Public Safety. Then Interim Fire Chief Jeffrey Happ and Support Services Administrator Kathy Collins and Police Chief Tom Quinlan will highlight the budget proposals for their respective divisions and outline goals and initiatives for the coming year. After each division provides a presentation, I will offer an opportunity for my colleagues to ask questions. And we're going to move rapidly into this process. And with that, Deputy Director Dan Giangardella, the floor is yours, sir.
Thank you, Chair Brown. I hope you can all hear me. President Harden, Safety Chair Mitchell J. Brown, members of Council, good evening. On behalf of Safety Director Ned Pettis Jr., we are here this evening to discuss the Public Safety proposed 2021 budget. We all recognize that 2020 has been a year like no other in recent memory, a pandemic that launched a health, economic, and humanitarian crisis, all of which not only significantly impacted the Columbus community, but also impacted the services provided by first responders and the first responders themselves. Like so many of us, public safety too has had to work and think differently in 2020. But while many of us have worked remotely or via video conferencing, police officers and firefighters have continued to respond in person to keep the community safe. Safety has always responded to an unprecedented demand on the part of the community we serve to do better, especially when it comes to policing in our community. With that in mind, we appreciate the budget proposed for public safety as it represents the mayor's important goals of investing in neighborhoods as well as protecting life and property. With me this evening to discuss their respective 2021 budget initiatives and help answer questions are Interim Fire Chief Jeff Happ, Acting Support Services Administrator Kathy Collins, and Police Chief Tom Quinlan. The 2021 public safety budget totals approximately $637 million, which is $12.12 million, or almost 2% less than the 2020 public safety budget. The budget allocates $336 million for police, $265 million for fire, $22 million for support services, and $12.7 for safety administration. Major funding items and changes in the Safety Department budget in 2021 include 2 classes of police officers of 45 recruits each in June and December, 2 fire classes of 40 recruits each in June and December, $3 million for upgrade and replacement of body-worn cameras in police, which was a major initiative of Mayor Gensler when he took office back in 2016. That was intended to increase accountability and transparency for police officers and the community. Safe Streets Initiative is funded at $2.9 million in police, which is a similar amount to 2020. $825,000 for Shot Spotter in police, which is a $200,000 increase over the program this year and last. Cadet classes of 20 each in police and fire, continuing that cadet program, which has paid dividends in terms of recruitment efforts for police and fire. Overtime budgets of approximately $10 million each for both police and fire, which is comparable to this year. Indigent burial cost of $260,000 and an EMS billing contract of $1.5 million. There are also funds budgeted in other departments in the overall general fund budget that will support public safety initiatives or address areas of community health. A majority of these funds, which total approximately $30 million, are mostly allocated to the Comprehensive Neighborhood Safety Strategy Program, such as $5 million in the Department of Technology to upgrade the police records management and case reporting systems, funds in citywide accounts to continue to implement recommendations from the Police Division Operational Review Study known as Matrix, and recommendations of the Columbus Community Safety Advisory Commission. Approximately $1 million to fund the Civilian Review Board and Inspector General, which was recently approved by voters. Approximately $1.8 million to fund social service workers in the health department to support crisis response and intervention. Continued funding of the REACT and mobile crisis response teams in fire and police, as well as substantial funding in several other city departments such as health, neighborhoods, recreation and parks, development, finance and management that supports several initiatives involving community safety, including crisis response, neighborhood pride, affordable housing, the ASK program, and various other crisis intervention programs. Also, in the recently approved capital budget, there are several items totaling approximately $22 million that deal with first responder wellness, body-worn camera storage, crisis addiction, and affordable housing. All initiatives that either directly or indirectly seek to improve overall community safety. Replacement of vehicles for public safety are typically funded by finance and management. The Public Safety Department works with the Fleet Management Division each year to determine the priority and number of vehicles to be replaced. The total funding for vehicles will be determined at a later date. In 2020, however, 177 vehicles were purchased for the Division of Police, including 73 marked units, 20 marked vehicles purchased for the Fire Division. Specifically addressing the police budget, there is a reduction of $24.6 million, or nearly 7% less in general fund budget when compared to this year. This does not take into account that most city departments, including the police budget, typically see an increase of a few percentage points each year. For instance, the original 2020 Division of Police budget was $17.7 million more than the police budget in 2019, or almost a 5% increase. With respect to the Matrix report on the Police Division Operational Review, Public Safety and the Police Division continue to implement the organizational recommendations and initiatives contained in the study of police operations. Chief Quinlan will address many of these recommendations and initiatives in his comments this evening. Many Matrix report initiatives for 2020, however, were short-circuited due to the COVID pandemic that began in March. Also, in late January this year, the Columbus Community Safety Advisory Commission presented its report to the city on a review of police recruitment, training, policies, and procedures. The commission, which was announced by Mayor Ginther in November 2017, focused on de-escalation, crisis intervention, implicit bias training, use of force policies, diversity recruitment and retention, and early intervention and officer wellness programs. Updates on the progress of both the Matrix study and the Community Safety Advisory Commission recommendations can be found on the Division of Police website at www.columbus.gov/CPD-dashboard. The Safety Director's Office budget is $12.7 million. This is an increase of $4.3 million due to the transfer of 50 fiscal and HR positions from the three divisions that the directors of the Director's Office budget. The reason for this reorganization is to align these support functions in public safety with other large city departments. Also to increase administrative efficiencies, improve internal communications and control, and to minimize duplication of similar services. For instance, all city payroll, legislation processing, personnel hiring, budget preparation, and procurement are the same across all city departments. Therefore, improving coordination, communication, and consistent application of these functions will improve service delivery. Also, one of the recommendations in the Matrix report referenced streamlining fiscal processes as well as improving the grants application process. Both recommendations will be undertaken with this consolidation. Other significant funding in the director's office are $3.5 million for the jail contract, $846,000 for the Franklin County Emergency Management Agency, $225,000 for the Capital Area Humane Society, $375,000 for the Community Crime Patrol, $65,000 for police and firefighter recruitment activities, and $33,000 for the Crime Stoppers programs. Most of these are consistent with what has been done in the 2020 budget. The Support Services Division 2021 budget is $22 million, which includes approximately $1.6 in E911 funds that previously were budgeted in the Police Division. The Support Services 2021 General Fund budget is $14 million increase over 2020 due to the transfer of approximately 147 positions and associated costs for the 911 call center for the Division of Police. The transfer of the call center is in keeping with changes suggested and begun under a 2014 consultant study on reorganizing and consolidating 911 call taking in Columbus. The transfer is also in keeping with trends in major cities across the United States that are using technology to consolidate and civilianize call centers. In addition, the Matrix report also recommended the city should consider fully civilianizing the call center and dispatch operations and look to establish stable funding for critical areas of operation, such as the call center. Other benefits of this transfer are to allow the safety divisions to focus on the overall mission of protecting life and property, to reduce competition for funds within the police budget, to increase priority funding and hiring of call takers and dispatchers, to improve the training curriculum, to reduce call transfers and processing times, to continue the consolidation of call taking and dispatch services, which began in 2015, and to elevate and transform the overall mission of the Support Services Division, which already maintains technical support for the call center. Before proceeding to the chiefs for further information, I would be happy to answer any questions you may have regarding the Safety Director's Office budget and organizational changes. Thank you.
Thank you, Director Dan Giancardella. Are there any questions with regards to the Department of Public Safety's overall budget from any of my colleagues? And I see Councilor Tyson has joined us, but are there any questions from any of my colleagues? Director G, Rob, did you have one?
I did, Chair, if that's all right.
So, of course.
Thank you, sir. Dan, could you, you talked about the size of the classes, both for fire and for police. Are those keeping pace with retirements and attrition? Or are we expecting there to be additions to the sworn personnel based on the size of those classes?
Yeah, I think I'm on microphone. No, we expect those classes to only go to support the individuals in police and fire that we anticipate leading. We've had obviously a pretty good history of the number of individuals that have left each year. And right now, I think we're already on pace in police. We may lose 90 even before the end of the year. And I believe we're also on pace in fire. So this will just keep our forces at pretty much at their current level at this point. Thank you.
Thank you. You also mentioned $1 million in the budget for the Civilian Review Board and the Inspector General. Since these are new entities within the city of Columbus, I'm curious how the department went about coming to that figure. Just wanted to sort of ask that question so that the public can understand how we're anticipating budgeting for that. Because one of the things council talked a lot about was making sure there was sufficient funding for those bodies.
Yes, I think in some sense it's an estimate what we believe the size of that board will be, and then of course the staffing required for the Inspector General. Right now those funds are budgeted in finance and management. And we believe that those should be plenty of resources to take care of this. And if obviously we'll work in coordination with finance and council and the mayor's office to make sure that there are no issues with funding that. So we believe that that should be an adequate amount, at least to start from what we know at this point. Thank you.
Thank you, Dan. One last question for you, and this is a constituent question that came to my office. One question that's come up, just within this budget, are there any funds that have been allocated or will be allocated to any type of software that has to do with facial recognition or any other activities such as that?
I am not aware of anything of that nature. I could also let the police chief Quinlan may know, but I am unaware of any facial recognition software that we use at this time.
Sir, nothing in our budget that identifies that. State has their own software that does facial recognition that sometimes we log on to use for like OLEG, but that's strictly through the state, nothing in our budget whatsoever.
Thank you, Chief. Thank you, Dan. That's all I have.
Thank you.
Councilmember Tyson?
Yes, hi, thank you, Councilmember Brown. And maybe I should wait till Chief Quinlan speaks, but I definitely want him to share some information regarding on this strategic priority, create and expand key policing reform strategies that include a new youth services operation and victim services. I'm very interested in that section. Thank you.
You're perfectly welcome, Councilmember Tyson. I know Chief Quinlan, he's going to be batting cleanup. So we have Chief Happ from Fire who will be up next, and of course, Support Services. Council President Harden, of course.
Thank you so much, Mr. Chair. Thank you for bringing, this is the all-star team. You have everybody from public safety. These are all of our friends. So thank you guys. Thank you for the work. And I think it was really important as on the onset of this hearing to talk about just how difficult this year has been, the work that has been done on behalf of public safety, first because of COVID, and then of course, because of the demands for social justice and police reform. Just want to acknowledge that this is a different year, and the strain that it has put on everyone, and just a point of gratitude and appreciation as we look forward to 21 and how we can continue to move forward. A quick question. The Community Safety Advisory Commission recommended instituting a new early warning system. I was wondering if Dan G, Director, if you could explain what that early warning system is and tell us if that is incorporated in this budget proposal from the department as it stands.
President Harden, Chair Brown, members of council, I don't believe that it is funded here. I think there's some things to work on that. I'll let Chief Quinlan address what actually that does. But if I recall correctly, that's obviously a system whereby we would be able to look at officers that might be having trouble, get them the mental health that they may need, and some other issues. So I'm not sure I think there's some software that potentially you would have to look at, and certainly we'd be willing to take a look at that. I would also let Chief Quinlan chime in on that answer as well. Thank you.
Thank you, Director. Council President Harden, there is, the hope is with the funding that we have identified for the CAD RMS, which I'll talk about here in a few minutes, is we're hoping that there will be enough in there to build a suite. It's a 4-pronged suite. It's the computer-aided dispatch, records management system, a criminal case management system, which are multiple matrix and community safety recommendations involved, and an early intervention system. Now, the early intervention system would be built around a company, say Alta Vista or Benchmark Analytics, that would be interoperable with the cloud-based system we're looking to purchase. They do work with the one vendor. I know for a fact that they do work seamlessly together. What that's designed to do is not just look at, right now we look at how many uses of force an officer has over a 12-month period and how many citizen complaints. That is not always the best predictor of an officer in needing an intervention. Sometimes check mark-offs, sometimes changes of address. Sometimes it's good to know by a dashboard how many times an officer's been to an infant SIDS death or a traffic fatality involving a child, or a homicide scene. In the last month, if those have happened multiple times, maybe it's an idea a supervisor can get notice to take that person offline and maybe give them some other duties, just to give them a mental break from what they're dealing with day in and day out. And this is the only system that would allow us preemptively to look at all those triggers together to make a decision whether we need to have an intervention.
Thank you, Chief, and thank you, Mr. Chair. I'm sorry to pull us out of order. One last question. I think this is specifically for the Director's Office. It's kind of in line with that. One of the other recommendations, and I know that we have moved forward with this currently, was for expanded oversight and accountability in policing and the Public Safety Department, hiring another person within the Public Safety Department office for police accountability for looking in background issues, not background issues, but work-related complaints. Can you talk about that expansion in this year, with this year and next year, Director Danji?
Yeah, President Harden, Chair Brown, members of council, there's been a number of hires, as you may be aware, in the Safety Director's Office. And I know the director is keeping that in mind, has it under advisement. And it is I know it's a priority of council. It was something that was recommended in the studies, and it is something we do plan to move forward with in 2021.
Thank you, Mr. Chair.
Thank you, Council President. At this point, there are no additional questions for Dan G. I do want to make sure we get the other presenters in, and so we can have lots of time for additional questions. The next presenter will be Interim Chief Jeffrey Happ of the Division of Fire. I think you're on mute, Jeff. There you go.
Yeah, my apologies. I assumed you guys did it from your end, but my apologies. So President Harden, Safety Chair Brown, members of council, thank you for this opportunity. With respect to the internationally accredited Division of Fire, the Division of Fire is composed of 5 bureaus, each of which is focused on meeting the goals and objectives as outlined by council and the mayor's office. Changes made to the Fire Prevention Bureau inspection program in 2019 has shown great results in 2020. This has resulted in improvements in the number of quality of fire prevention inspections performed. These efficiencies were needed given that the city is adding 40 to 60 new buildings monthly. This growth, while exciting and dynamic for the city, does create expanding workload challenges. The Bureau will look to new technology and processes to meet the growing demand. Through community engagement with the smoke detector program, we continue to make families safer by installing smoke alarms in many neighborhood homes. We have also worked with the building department to allow customers to more easily apply and obtain inspections and permits. The Division of Fire EMS Service Bureau continues to see expansion of our EMS responsibilities and the new challenges faced during the COVID-19 pandemic. Daily, the division averages nearly 500 calls for service and has responded to over 147,755 calls this year, assisting our residents and visitors to Columbus. This is trending about even with last year. The emergency services concentrated training on improving the leadership skills of our company officers, implementing leadership essentials and development series leads in 2020. This has resulted in an increased focus on our members' mental health and wellness and gives our supervisors the necessary empowerment to provide exceptional care for our residents. The Support Service Bureau opened new Fire Station 35 located on Wagner Road in 2020 and is scheduled to open Fire Station 16 at 1465 Oaken Park later this month. Fire Station 16 is located in North Linden and replaces the current station on Weber Road. This continues a commitment the city and the Division of Fire has shown to provide timely and effective EMS and fire responses, providing a response time of less than 8 minutes to 91% of our calls for service. These stations have added an additional focus. Being the first in our city to be built with an emphasis on EMS firefighter safety, designed to decrease the cancer exposures our members face to toxic environments. The Division of Fire's Recruitment, Diversity, and Inclusion Office continues to promote opportunities to become a Columbus firefighter, shifting to virtual efforts and new marketing strategies as a result of the pandemic. The Division of Fire's continuous goal is to reflect the diversity of our community throughout our workforce. We expanded the use of social media and utilizes a text-to-apply process. This provides immediate engagement with any prospective recruit by just having them text, "Join CFD 474747. The Fire Cadet Program, launched in 2019, has shown great results, and a second cohort of cadets began their journey in 2020. Our partnerships with stakeholders have been invaluable in expanding our reach to connect with the community, and the results are being realized through their efforts. Since inception of the cadet program, 5 cadets have become Columbus firefighters, and 20 more cadets are on the current eligibility list. Our goal is to hire highly qualified individuals who reflect the community we serve, and all efforts have been devoted to more than doubling the level of diversity and division within the next 5 years. In 2020, we continue our focus on the opioid epidemic by utilizing EMS to reduce deaths due to overdose. Our Rapid Recovery Emergency Addiction and Crisis Team, REACT, was active in assisting individuals struggling with addiction. This team comprised of Division of Fire paramedics, CIT trained police officers, and social workers who specialize in addiction treatment, has become a model in the nation. In addition, we want to acknowledge the support of the Mayor's Office, City Council, City Attorney, County, and the City and County Health Departments. This additional funding through these budgets, as well as grants, have allowed this program to make a daily impact on the crisis, being a bridge to treatment and recovery. The cooperation has also led to this unit's receiving multiple grants to support the program, and has also allowed this unit to be an example of the best practice being copied by cities across the country. The success of this multi-agency, multidisciplinary REACT program has led to the creation of a specialized program assessing resource connectivity SPARK team. The team pairs a paramedic and social worker from Central Ohio Area Agency on Agency, COAAA, to work with our medically fragile and vulnerable residents who have become over-reliant on EMS. These secondary response teams provide assessments and navigation to connecting individuals with resources that improve their health, capital, and reduce their EMS encounters and hospital ER visits. The SPARK team early success has resulted in approximately 30% reduction in EMS calls for individuals who have assisted over the past year. The Division of Fire continues its partnership with Ohio Health, Mount Carmel Health Systems, and the Ohio State University Wexner Medical Center to provide the state-of-the-art life-saving care to stroke victims before they arrive at the hospital. The mobile stroke treatment unit is a specialized vehicle designed to diagnose and provide definitive care to victims of stroke in the field. This is important because a stroke can rapidly damage the brain if left untreated, making every minute count. When the unit arrives on scene, a team of trained stroke care professionals virtually connect to the Ohio Health stroke neurologist. A CT scan helps determine the cause of the stroke, and the neurologist determines the appropriate treatment. The patient is taken to one of the 3 comprehensive stroke centers in Central Ohio: the Ohio State University Wexner Medical Center, Mount Carmel East Hospital, or Ohio Health Riverside Methodist Hospital. Some 2020 stats: we've had 1,610 dispatches year to date for the stroke mobile, 267 transports, 255 CT scans, 158 ischemic strokes, and 26 hemorrhagic strokes. The division appreciates and looks forward to the addition of 80 recruits planned in the 2021 budget. This addition will help us not only replenish the loss of personnel due to separation, but also prepare for the expansion of programs such as SPARK and REACT in 2021. Before closing, I would like to thank Mayor, the Safety Director, and Council for their continued support for the Fire Division and Public Safety. Over the past year, a lot of great work that fire and police have accomplished is a result of your effort to support public safety response to some of our most vulnerable residents. The collaboration and teamwork between fire and police have resulted in innovative solutions that provide life-saving care. I would like to thank Chief Quinlan and his officers who are carrying Narcan and saving lives every day. His officers who are trained and equipped with AEDs and providing CPR prior to EMS arriving, which is resulting in residents surviving sudden cardiac arrest. Although our jobs may seem completely different, we have one common goal, and that is to provide help for everyone who calls 911. This year's proposed budget builds upon these collaborations and is a step forward toward reimagining public safety. The Division of Fire is proud of our accomplishments in 2020, and with your support, we will continue to focus on our mission of providing timely and effective fire and emergency medical services. Thank you.
Chief App, thank you very, very much. And I want to pass it on to you to make certain that all of our firefighters appreciate that the City Council appreciates the work that they do in these most difficult times involving COVID. I know the pressure that is put upon them, and when they have to go home to their respective families. We have firefighters changing clothes in the garage before they actually go into their homes. So please pass along the sentiments from this council and from Councilman Brown specifically. With that, are there any questions from my council colleagues? Seeing none, let me ask, Jeff, can you answer the question about the mobile stroke treatment unit? To convey that it is a portable or a mobile CT scan is inside the vehicle, showing the pictures to a physician, correct?
That is correct. That is correct, Safety Chair Brown. The benefits of the life-saving collaboration reduces the time between diagnosed treatment for an individual who has suffered a stroke. Every minute counts that goes by before treatment causes damage to the brain. So the mobile stroke team's ability to accurately diagnose a case by sending that CT scan to a doctor at a hospital and having him read that scan and be able to give the appropriate medicine to start helping that patient before they even receive that are received at the hospital. So we are thankful for the collaboration of our hospital partners and are proud of the division's commitment to provide life-saving unit for our residents of the community.
I know the council president and I, when we initiated the program some time ago, the pride that we expressed on behalf of the city, strokes are a major issue, and making certain that the right response to the given problem is very, very important. And that is very, very special. So again, looking at the mobile stroke treatment unit as it continues to expand is going to be very, very important. Also, I'm sorry, Council President. Yes, sir.
No, director, or not director. Sorry, Mr. Chair, go ahead.
What I was going to, I also would like for the chief to speak to the sparse team and what you see for the future with regard to the sparse team.
Absolutely. So the Spark Team program, and again, it stands for Specialized Program Assessing Resources Connectivity, was launched in 2018, shortly after REACT program. It was started because of the tentacles that were starting to be realized with REACT and how we could be a better service to our community. But we utilize the same concept of a multidisciplinary team and CFD's 911 data. We partnered with the COAAA, which is the Central Ohio Area Agency on Aging, to provide individuals with navigation connection to social services and resources that can improve their quality of life and allow them to age safely in their home. They trust and access the Division of Fire has into our community positions nicely to provide these services and connect individuals with community-based providers for ongoing long-term care. SMARC is the connection point that makes it successful and has resulted in a reduction of nearly 30% of our calls for our residents who have become over-reliant on 911 systems. So we are simply when we go out to high utilizers, we simply reach back out to them through our the Spark team and ask them if there's something they can do to get these people the services they need. And it might be as simple as a walker or a chair, but we're able to make that connection so that they don't continuously call for the EMS care just to put back in bed, or so it's been a very valuable resource so far, which is we've seen the number of calls starting to go down.
And also, Chief Happ, the 2 new fire stations that have been built with the emphasis with regards to the concerns about cancer exposures for our firefighters.
That is correct. The 2 stations that are built, one was getting ready to open in 2 weeks from now. The 2 stations are now equipped with heavy equipment and also technical equipment to keep cancer out of our fire areas where we're in the community, where we eat, where we sleep, where we have our training. The equipment that is installed at these new firehouses, the ability to take showers and as soon as you get off the truck and clean your gear almost immediately, is actually cutting edge stuff to where we can immediately get on new equipment, new gear, new fire pants, new fire shirt to get out of that cancer stuff. So these 2 new cutting edge stations are monumental, and just we thank you guys so much for supporting us on that and getting those into these stations.
And also, Chief, one last question from me, and certainly I'll turn it over if my colleagues have any questions, but the overdoses that are occurring in our community, just to give a bit of perspective on the volume and how we, when I say we, the fire division, and we, the police division, have had an impact on improving the quality of life.
Councilmember Brown, could you repeat that? You kind of broke up just a little bit.
The question was, Jeff, how do you address the issue of the impact drug overdoses are having on our community and the issuance of Narcan? I know we do it through a different method with regards to the vending capability, but also the relationship, again, with police as far as their application of issuing Narcan.
Yeah, so one thing great about this Spark and actually the React program is we have not seen any less in service to reach out to these people because of our current things we have in place to make sure that we're wearing proper PPE to go out and see these people. We are still able to hit the streets with the Spark team to still engage with their community and still go out and actually distribute Narcan and have people meet us at different venues to actually have those Narcan distributed to them. But it's not the impact of this epidemic is not slowed down Spark or React at all because again we have the equipment, we have the resources to go out and distribute them and get them the help they need.
And also one last question for me, Jeff. I'm sorry. Again, the relationship between police and fire, cardiac arrest, if I'm not mistaken, and we'll get to Chief Quinlan about this, but our police officers are carrying AEDs inside some of their vehicles. And again, they are also equipped with Narcan and the impact that it's had on the quality of life.
Absolutely. So that's been one of the greatest relationships that we've started to empower with the police department is they carry AEDs. There's a couple dozen AEDs on officers. So when they receive the call, there might be a block away. They're able to go and actually render first aid or actually put the AED on before the fire shows up. So as well as a Narcan, all the police officers are now carrying Narcan, so they're able to get to those people faster than we can because they're out in the area in that community. So that relationship of them, again, carrying the AEDs, the Narcan, they're helping making a difference to the residents of Columbus that are struggling with addiction.
Thank you, Chief Happ. Are there any questions again from my colleagues for the fire chief? President Harden?
Thank you, Mr. Chair. And thank you, Chief, for the presentation this evening. And again, please pass along our appreciation for your guys and gals who have served us so well during the COVID crisis this year. There's been a lot of conversation in terms of police around diversity and inclusion, around recruitment. I know that you guys, I think we created it last year or the year before last, the Cadet Program. Would you talk about the funding request pertaining to that program. You hit on it a little bit in your presentation, but any successes you're having and how we're doing with minority recruitment.
Absolutely. So President Harding, Safety Chair Brown, and all council members. So the cadet program, I touched on just a little bit on that. We currently have 5 cadets that started in cadet class 1 that are now firefighters. So that's a 25% increase just from starting the program. And we're hoping to get an additional probably 10 or 11 out of that class. The second class has started. We now have tested them, and all 20 of them have passed, and now they're on the current eligibility list as well. So we're hoping within the next 2 years we'll have 35 of those cadets going through our recruitment background. So as far as recruiting, the 4-7, when we're out in the community, most kids have their cell phones, so it's able to connect these kids quickly with their cell phone by just typing in join CFD to 4-7, and immediately gets them an application. So with those things that we've created, it gets us right to the community. We can actually engage with those kids that all have cell phones across the community, but it's able for us to keep them engaged and keep communication with them.
Thank you.
If I didn't answer it completely with the diversity, inclusion, and minorities, we are trending upward. We almost hit down about 10%. Now we're starting trending upward. We're getting ready to start the class in next December 14th, and we're up to 14 minorities in that class. I'll give you, there were times we never had a minority or in that class. So great strides been changed. Last class was 11, and the class before that was 17. So the numbers are still climbing. So we're excited about this program that we started, and its continuing success. And cadet class is just a part of that as well. So
Thank you.
but thank you for all your support, and council and the mayor. They're the ones help support us to be able to do these things. So thank you.
Chief Hap, I have a question. I think I just saw an article today in today's paper, and the news that popped up about a young lady from our community that was now joining the cadet class. Is that right?
That is correct. She started August 3rd. Yes, she did. And it's a great article. Yes. From Marion Franklin, if I remember.
Yes.
Yeah. So it's a great article. So she's taking the class. She's in the class right now, going through EMT school. And she's actually took the fire test, and she's taken the foam test, and then actually she did a firefighter model, and she's completed everything. And so her name is listed on there. And so she may start in June or possibly the following December. But yeah, we're excited. There's a lot of them like her that are on there. So we're extremely excited about how well they're doing. So
It's great to see women, young women, and certainly young women and minorities, right, become a part of our program. So thank you. It was a great article. Thank you.
you're welcome. Thank you.
Councilman Dorns, before I go to you, Jeff, why don't you also, congratulations to you, and obviously to Steve. You have a woman for the first time as deputy chief?
Assistant chief now. You're right. A few months ago, Assistant Chief Tracy Smith was promoted to deputy chief, and then recently she got promoted to assistant chief. So she's a part of our team now, and she has worked with the minorities of the community and the females, and she always does a lot of things with the females to kind of bring them along and let them know that you can accomplish anything, and she's a perfect example of that. So yes, very happy to have her join the team. And but yes, Assistant Chief Tracy Smith. That's correct.
Councilman Dorns?
Thank you, Chair Brown. And again,
Yes.
Chief, just want to express my thankful appreciation for both, folks at the fire department and certainly division of police who are out there every day protecting folks in not ideal circumstances at the moment. So, so thanks to the folks out there doing that. Just one quick question, and trying to frame this in a budgetary standpoint. I think you mentioned it a number of times, and certainly Chair Brown did. the emphasis on response time obviously is huge for the Division of Fire to make sure whether it's a medical emergency or a fire or something else that requires your attention. Wanted to ask the question about as it relates to a budget item, how mutual aid fits into that in this year coming forward. We rely upon some of our suburban partners to help us out with that response time when necessary. I want to know if you could speak to that again as we're looking at this 2021 budget and how that sort of relates to the budget that we have in front of us.
Sure. And if I might just use Franklin Township, because that's one of the ones that we kind of use all the time. So I'll reference that. Okay. So, like the situation in Franklin Township is constantly being monitored, and we have a contingency plan in place, to ensure that all of our residents receive timely fire and EMS responses. An additional engine and medic are fully equipped and can be deployed immediately in an event that, like Franklin Township, is unable to maintain the coverage and to help us out. And that's what this is. Most of these outlying departments help us out more than we help them. But the division is exploring options, in the Frank Road area for possibly putting a future fire station in the event that Franklin Township shuts down and completely. Right now, with their budget passing, they are still operating, but it's sometimes day to day if guys call off. But we had this on our radar prior to COVID, but has definitely been moved up the priority list since COVID to making sure that if these departments cannot respond in a timely fashion for us, whoever it is, these outlying departments, then we must put this up so we get our residents the quick and adequate response that they need. So we do have plans in place daily and talk about it daily if one of these departments go down, say for COVID. And it's very easy for one firehouse or one station to get wiped out completely. For these small departments, then it could be detrimental to our response time. So we're constantly monitoring that. But so we'll continue to work with and support our mutual aid partners, but ultimately the responsibility is ours to provide proper coverage in the city of Columbus so that we are ready, to go at any time. Thank you.
Yep. Thank you, Chief.
Also, I think Councilmember Dorns, what's really important, again, as we start to talk about the diversification of the response teams for the circumstances. And I know our fire division, again, maintaining the ability, the volume for calls has just increased significantly, as you've heard them already say. So that this budget does address those concerns as we continue to figure out how we're going to expand. Fire Station 35, if I'm not mistaken, Chief Happ out there has made a tremendous impact on our ability to respond to calls and taking the burden off of some of the other stations. So it's something that they continuously monitor, Council Member, and feel free to talk to us about making the adjustments when we have to.
Thank you.
At this particular time, I'm going to turn it over to Kathy Collins from the Administrator for Support Services.
Thank you, Safety Chair Brown, President Harden, and esteemed council members. The Division of Support Services is the third division under Public Safety, whose mission is to provide communication and technology services to our first responders, as well as to ensure the public is safe in regards to licenses, permits, weights and measure inspections. First, I'd like to give some information about our licensing and weights and measure sections. The licensing section handled over 33,200 license permits this year to date, including the extension on renewals, which I'll talk about in a minute. For example, we inspect and license over 40 types of businesses: food trucks, taxi cabs, street vendors, hotels and motels, commercial sales, charitable solicitations, and arcades, just to name a few. Unfortunately, due to the current state of emergency, the license office has been closed to the public. However, we were able to license new businesses, mobile food trucks, taxis, and short-term rentals, among others, and renewals before we closed in the office in March, which have totaled 2,383 new alarm licenses this year. Expiration dates on renewals, on the other hand, have been extended during the current state of emergency, except for those most critical to public safety and health. which were, for instance, mobile food trucks, taxis, and hotel motels. Our largest growing category has been short-term rental licenses, and to date, we have issued over 1,284 short-term licenses to primary and secondary locations. Council will see some additional legislation in the near future to give the city the ability to better enforce licenses involving short-term rentals that are not being good neighbors. We also continue to partner with OSU and other entities to register over 4,000 bicycles this year in our revamped Bug Your Bike campaign, taking our total database to over 29,000 registrations since its inception. The Weights and Measures section inspected 13,747 commercial apparatuses as of November 27th of this year, which is only about 3,000 less than last year. I'm proud of this number as we worked at 50% personnel capacity for the majority of this year to minimize exposure since March of 2020 when COVID hit. Gasoline pumps were our priority, and we will be able to complete an inspection of every pump in Columbus by year's end. Other examples of inspections include laundromats, car washes, weight scales in stores, taxi meters, and air pumps, among others. The division is also responsible for the payment of indigent burial. We are still utilizing our contract with the vendor from 2019 at a rate which is lower than what was specified in code prior to the change in legislation. But unfortunately, as council knows, 2020 saw an increase in indigent burials. To date, we have paid out over 311 indigent applications with 2 months of invoicing to go. This number is up from a total of 288 in all of 2019. In regards to our 911 functionality and system, the big news is that we were able to accomplish a cutover to a newer version of our computer-aided dispatch system in late November of this year. The prior system was antiquated and would no longer be supported by the vendor. The updated system will result in a more stable environment for call taking and dispatching our first responders and better support and flexibility for the many interfaces connected to the system. It will also be a much stronger foundation as police and fire move into the future with new technology. The division also completed a Viper 911 upgrade this year that supports the entire county system, but which the city manages. In addition, along with the help of Franklin County, we purchased 35 Viper remote units that can be utilized for 911 call taking by public safety answering points in Central Ohio in the event their system goes down or to assist with other issues such as social distancing. The 911 communication centers of police and fire processed a total of 2,103,049 calls to date this year into the 911 communication centers. I want to emphasize that these are calls coming in, not dispatched runs. Those numbers include 827,171 total 911 calls, 1,275,878 of non-emergency and administrative calls, and 1,524 text to 911 sessions. This represents a 21 increase in calls for service over 2019. In the coming months, we look forward to resuming in-person applications for our licenses when it is safe to do so. In the meantime, we will continue to handle new licensing, questions, and issues remotely. The planned exploration of a new licensing and records management system was put on hold due to the office closure and employees working remotely, but my hope is to resume that process in 2021. Not having a more advanced licensing and records management system has been a deterrent in our ability to renew licenses remotely. These items are in addition to the other changes for support services that Deputy Director Giangardella has already briefed you on. I do want to thank Council for all the support that support services has received, especially in revisions to code on licenses. And I look forward to changes ahead in 2021, especially the communications movement from police over to support services. Thank you very much, and I'll attempt to answer any questions that you may have.
Are there any questions from my colleagues? I'd like to, Kathy, just one question in particular. What do you think will be the impact of the system upgrade for our emergency response capabilities?
Safety Chair Brown, we're very excited. It's going to be a very strong backbone to build anything onto. It's also going to give us the ability to, our prior system that was kind of antiquated required a lot of hands-on, even after hours attention. And we're going to hope with this new version of CAD that's going to be reduced, and it'll be a much more stable system for us that will allow us to build on both internally, and then as police and fire to find new technology that they want to attach to that CAD system, it'll be a much stronger, more robust system.
So am I to understand it'd be far more flexible for upgrade capability, is that correct?
Safety Chair Brown, that is correct. It'll be more secure, more flexible for many things that we want to do. For instance, we were attempting to put together a part of the legislation for short-term rental is going to involve calls for service over a year, and it will be much easier to be able to access that information for the licensing section to get that so that we can take that into consideration if there is a reason to deny or not issue a new short-term rental license.
Well, Administrator Collins, thank you very, very much. If you'll please hang on, then we will turn the presentation over to the Division of Police. Chief Quinlan, I believe, is still there.
I am, sir.
The floor is yours, Chief.
Thank you, Council President Harden, Safety Chair Brown, members of council. With respect to the Division of Police, the division has recently implemented several new programs aimed at reforming and improving community relationships. Programs supported through an employee wellness bureau has been an important step. We have added a therapy dog unit, placed AEDs in cruisers, and even with select bicycle officers. We've created units dedicated to youth services and victim services, which I will address Council Member Tyson's question on that during the question section. We've added a community education officer and a PACT unit. This acronym stands for Police and Community Together. It's a unit designed to address quality of life neighborhood issues such as nuisance abatements, prostitution, and more. Additionally, the division expanded the domestic violence unit and human trafficking task force. Moreover, the division continues to pilot test a police-initiated juvenile diversion program. I also implemented an adult summons in lieu of arrest program to better resolve nonviolent misdemeanors. Community outreach and engagement continue to be a focus for the Division of Police despite the COVID epidemic. Neighborhood meetings, social media, diversity and inclusion officers are each avenues used to remotely collaborate with our community and neighborhoods. We continue our youth TAPS programming despite current restrictions on meetings by using a virtual environment. Beginning May 28th and in the weeks that followed, the community voiced a clear message to the division that more work is to be done. In the latter part of 2020, significant policy and legislative changes took effect in response to meeting the community's expectations. I implemented a Chiefs Advisory Panel with community members selected by the mayor and city council members. Policies were implemented requiring officers to act with a duty to intervene. Proper tactics were added as a consideration during a use of force incident. Our EEO policies were strengthened by labeling all violations as critical misconduct. Chokeholds were prohibited except as a use of deadly force, and changing SWAT uniforms to a non-camouflage pattern uniform, and creating a specialized team with significant training who are prepared for and respond to civil unrest. Consistent with new CLIA requirements, I have added mandatory reporting when officers display a firearm or taser to control another's movements. Legislative changes have been implemented, such as severely restricting no-knock warrants, adding a ban on hate group affiliations to our rules of conduct and our oath of office. The division has entered an agreement with the Ohio Attorney General's office to investigate officer-involved critical incidents. The civilian review charter change was passed by voters. Our body-worn camera program continues to foster positive community relationships, transparency, and accountability. I added body cameras to tactical units such as SWAT and our tactical drug crimes unit. Both units encounter highly volatile situations and previously did not wear body cameras. This has been remedied using drug seizure funds to outfit these units. In addition, the division has reached an agreement with our federal partners to deploy body cameras on task force officers when conducting arrest and search warrants. Accountability is one of the division's core values. As a result, approximately $3.4 million is budgeted to continue the body-worn camera initiative as technology is increasingly allowing for automatic activations of the camera system and live streaming the police public interactions to supervisors. Over the past 6 months alone, officers recorded 390,402 separate videos documenting their activities and actions while on patrol. It is time to replace aged-out equipment that is no longer supported by the manufacturer. In March of 2021, the division will be seeking its 8th consecutive accreditation from CALEA, the Commission on the Accreditation for Law Enforcement Agencies. But I pause to look back at some harsh truths from the past year. 2020 has been challenging this year for the Division of Police. COVID has certainly impacted the division and how we operate, just as it has impacted everyone else. Beyond the COVID crisis, I unfortunately must report that the number of violent crimes in the city is significantly trending upwards, a trend that is being replicated in every major U.S. city this year. Homicides are up significantly, currently 150, up from 97 this time last year, an increase of 54%. There have been an additional 1,190 felonious assault cases, with 924 involving a firearm, any one of which could have been a homicide. The difference between a homicide and an assault can be credited to the quick actions and response by our dedicated police officers who provide immediate medical aid and secure the scene so Columbus fire medics can safely enter. Once Columbus fire medics arrive to take over, they provide a professional level of emergency care and transport, resulting in lives saved. And our great hospitals, who ultimately save many more people's lives, deserve great credit as well. In 2019, the division intercepted 2,570 firearms from the streets of Columbus. And as of today, the 2020 recoveries exceed 2,649 firearms. However, despite a demanding and dangerous environment, our officers continue to partner with the community and our federal and state partners in an effort to address this increase in violent crime. Through partnerships with the city attorney, county prosecutor, and the U.S. attorney, the most egregious offenders possessing illegal firearms are being prosecuted by the federal courts. This January, the division is also partnering with David Kennedy and the John Jay College to generate strategies focused on group violence intervention. We recognize very few people are involved in the bulk of the violence occurring. We are seeking to replicate proven strategies that will map out where resources are needed and what resources to offer. It looks a lot like contact tracing. This approach supports a unifying structure that brings the right assets to address solutions. Our ShotSpotter program continues to expand and has been an effective tool at saving lives and solving crimes. The 2021 budget allocates $825,000 to maintain and expand this program. To date, I am sure you will be shocked to learn that there have been 17,591 bullets fired in our community just within a few mile radius where our ShotSpotter technology is operational. Many of these bullets struck houses, and yes, many killed people in our community, including children and other innocent bystanders. Violence by firearms is a menace in our community and must maintain a priority by allowing all those involved in the criminal justice system to do their part to address this problem. The public safety budget must and does reflect this realization. Despite COVID, despite civil unrest, and despite escalating violence, officers are continuing to place themselves in harm's way by doing their very best to protect this community. We often recognize risk known to responses and arrests made by patrol and the equipment they need to do their job. I want to bring to the public's attention some unknown facts about the actual risk our SWAT officers face in doing their job and why units such as SWAT and our INTAC need specialized safety equipment that has been requested using criminal asset forfeiture monies. This year alone, our 21 SWAT officers have responded to 35 barricades and served 67 high-risk search warrants. These officers have arrested 298 violent felons, including 51 murderers, 115 people wanted for felonious assault, 64 aggravated robbers, and 24 rapists. SWAT seized 57 firearms during these arrests, including 13 fully loaded assault rifles. While SWAT officers arresting these armed murder suspects have done so in nearly every instance with either a taser or no force at all, one case is notable at one of the city's hotels. SWAT officers were arresting a murderer and were greeted by a barrage of gunfire in the hallway of the hotel. Many other situations handled by SWAT have involved armed persons in mental health crisis and often suicidal. And in one case involved a sovereign citizen who had shot 2 county SWAT officers. Safety equipment is imperative to achieve these results and save lives. So we have a pressing need and an immediate use for the additional 90 officers planned in the 2021 budget. Welcoming new officers to the division and creating new initiatives to confront violent crime will remain a top priority as we work to keep our neighborhoods safe. Further, new hiring extends opportunities to improve the diversity represented within the division ranks. 89 officers have retired or resigned so far in 2020, and we hired 38 new officers in July, and another class of 45 will begin December 14th. Our Diversity Pipeline Cadet Program. In 2019, the division hired 16 cadets, having 80% representing diversity. 12 of the 16 have passed the entrance exam. 1 starts the police academy on December 14th, and 2 more are on the standby list. 9 are awaiting classes in 2021. 15 more cadets were just recently hired, with 6 eligible for the 2021 civil service test. We continue to focus on training for both police recruits and incumbent officers. Our goals remain to provide state-of-the-art training to our personnel so they can effectively deal with violent crime while meeting community expectations. We focus heavily on scenario-based de-escalation, decision-making, procedural justice, and crisis intervention training. Our training excellence is illustrated by the fact 17 Central Ohio police agencies trust us to train their officers, a very valuable partnership with many rewards. De-escalation tactics continue to be a training priority. This includes the use of less lethal devices to safely secure a person into custody. For instance, the division deploys a taser approximately 150 times each year. And I need to point out, officers respond to more than 665,000 calls for service each year. Of the 150 taser deployments, when this less lethal tactic was used, 55 involved a situation dealing with an emotionally disturbed or suicidal individual, which resulted in a safe outcome for the officer, the individual in crisis, and our neighborhoods. Addressing those experiencing mental health crisis remains a priority. The division has 498 certified CIT, crisis intervention officers of all ranks. CIT officers responded to 20,594 of the 35,262 calls received requiring a police response this year related to persons experiencing mental crisis. Officers transported 6,333 people to area hospitals or mental health facilities. Only 399 of the 20,594 individuals resulted in an arrest, representing 2% of these contacts. The division continues to partner with Adam H., using 7 NetCare healthcare clinicians with 7 crisis intervention trained officers to respond only to mental health related calls for service. The 2021 budget allocates funds to increase this initiative by an additional 20 clinicians. What was accomplished with the current staff of 7? This year, our mobile crisis response teams responded to over 3,800 calls for service and worked to link clients with community services. The 3,800 responses led to 1,200 transports of persons in mental crisis to mental health facilities so far this year, and only 5 uses of minimal restraint, which involved merely a transport wrist lock or use of a pressure point, for instance, and no greater force was used. Only 3 of the 3,800 encounters resulted in an arrest. The success of the MCR program is clearly evident in these results. While MCR only handled around 8% of the total runs, how many future runs may be diverted to a partnership between a CIT officer and a NetCare clinician when the program is expanded by 20 officers? A budget priority having predictable results. Narcan was administered 326 times this year by officers, each resulting in a life saved. Officers used an AED 12 times this year to save a life, and officers applied a tourniquet 14 times, resulting in additional lives saved. Our partnerships with Columbus Fire, and I must take a personal minute to compliment Chief Happ. We have our relationship and partnership has just continues to improve every day. So our partnership with fire is a tremendous success, and our tactical medic program, our explosive trained canine, the training and assistance provided with our AEDs, Narcan, and tourniquet programs are all achievements received because of our partnership with Columbus Fire. Our in-house industrial hygienists and our training with fire have ensured police are better prepared to save more lives. The Division of Police continues to implement recommendations from the Matrix Consulting Group, having already implemented 57% of the recommendations. The division also has implemented 58% of the recommendations from the Columbus Community Safety Advisory Commission. Further recommendations are either outside the purview of the Division of Police, require collective bargaining, or necessitate budget approvals, many of which are addressed in the 2021 budget. The most critical portion of the 2021 budget request lies within technology and the absolute necessity for a cloud-based computer-aided dispatch system, records management system, criminal case management system, and an early intervention system that provides interoperability across the platforms. This system will be instrumental in aligning the mission of the division with the services and experience the public demands and deserves. Efficiencies gained from this technologically advanced system will provide greater proactive time to engage with our residents. The system will provide greater accountability for investigators to manage caseloads and supervisors to oversee work products. Early warning for spotting employees who are ripe for an intervention, in need of greater training, or employee assistance is the right thing to do for our workers and good for our community. The mayor has also generously earmarked funding for a joint police and fire wellness center. This center will provide early intervention opportunities in an environment where personnel can better manage the stress that accompanies the harsh realities experienced routinely and repeatedly by officers over many years in policing. We owe our personnel a mental wellness system, and the public will be the direct beneficiaries of the effects of this new wellness center. The Safety Commission also calls for this program to be implemented. A brief look ahead. A wise person, I know, in fact, it is a member of City Council, once shared a quote with me he likes to recite, and it says, "I can't change the direction of the wind, but I can adjust my sails to always reach my destination." To coincide with our past successes and present intentions, and based on the budget request for 2021, there are certainly adjustments to the division's sales worth mentioning. The implementation of a cloud-based RMS system will again provide greater proactive time for officers to engage and safeguard our community. Plans to maximize our effectiveness at building better relationships includes a robust patrol reimagining plan and expanding our youth services programming. I plan to create neighborhood coordination officers. These officers will micro-target specific segments of our community to extend city resources where they are needed. Keeping with this theme of responsiveness, I plan to create dedicated precinct detectives to focus on and coordinate with patrol officers in real time to address crime trends and patterns. We will continue Safe Streets programming once COVID restrictions allow us to function, using greater face-to-face interactions and development of a real-time crime center. Uh-oh, I ran into a problem with my technology here. I'm going to catch up, sorry. Which will improve the solvability while offering greater opportunities to prevent acts of violence before they occur. And I apologize. Tested this out and everything worked fine. Now it's not working. Just a second. Okay, my apologies for that. So we will continue our Safe Streets programming once COVID restrictions allow us to function, using greater face-to-face interactions and development of a real-time crime center, which will improve solvability while offering greater opportunities to prevent acts of violence before they occur. I offer this response to the 2021 budget proposed and thank the mayor and city council for their insight and commitment to making public safety a high priority. Thank you for your attention.
Thank you, Chief. Very, very in-depth. Again, for all my colleagues to appreciate the fact that that is a compilation of the past year, since we're in the month of December, all the variety of different things that have impacted, and a number of them are significant. So before I respond, I think the one number, Chief Quinlan, that is significant for me was the 17,591 shots fired in our city in one particular area. That is certainly and unequivocally unacceptable. We're going to do all the things we can to try and minimize that when you consider that we currently have over 150 homicides by comparison with 97 of last year. And my hat's off to you, sir, and to all the detectives working aggressively to try and solve these homicides. If I'm not mistaken, Chief, the homicide solve rate is what now?
About 54%, sir, up from 42%.
Which again is significant. And I think for the viewing public and listening audience, the realization is that a connectivity of our law enforcement, our firefighters, and our EMS systems have made a great impact on individuals surviving all these gunshot wounds. With that, let me ask my council colleagues if they have any questions. I know Councilman Tyson, you want to make sure you get your question answered. Be my guest.
Chief Quinlan, do you want me to ask the same question again, or do you remember what I asked?
I have the question. So what are we doing to expand and further develop programming for our youth service and victim services? Let me begin real quick with our victim services. So we have two functions going on there. One, we have one full-time officer dedicated with our PAC team looking at human trafficking and other issues that are impacting young women and other vulnerable populations in our community that need access to those resources and somebody looking out for their best interest. And we have great partnerships with the court in Catch Court in doing some of those functions, and Salvation Army and many others. Now, the other portion of that is what my goal is to have victim services provided. So when a person is a victim of a crime and the detectives work second and third shift and they're out on the street on responses, and it leads to frustrations by calling and trying to get information about your case and playing phone tag, or somebody's off, or no one knows what you're discussing, so they can bounce you around. I want a system where we have, and we're using cadets in some response to this, is where you can call in, talk to a person, and they will connect the dots for you. They will get you in touch with the person, the right person you need to speak with at a mutually agreed time, so we eliminate some of those frustrations. Typically, until a charge is filed, the court has victim service as well, but that's only once a charge is filed. The frustrations that happen is when, what's going on with my case when it's not solved yet? And so we want to make sure that there's better lines of communication there, and that we deal with the frustrations on our end, so the victim does not have to shoulder that burden. Now, for youth services, we've developed a program on first and second shift to have officers dedicated that are allowed to actually work with youth in the community where we find youth, meet them on their terms, on their turf, if you will. Whether it be in Boys and Girls Clubs, rec centers, street corners, wherever we need to interact. So these officers are going to be allowed to read to students, play basketball, do some mobile learning opportunities, different programming where they can have positive engagement interactions and have a resource to go to, someone they know by first name, that when they need something or something's brewing, they have a way of reaching out without being singled out or without being bounced around. We want them to have that resource. Again, a lot of this crime is group intervention. It's under this Kennedy approach, John Jay College, it's really a small number of people that are driving a lot of this crime. And a lot of it's, again, gun-related crime. How do we provide youth services to that group that is so vulnerable? Many of them are victims, and too many are suspects in these crimes. So we want to have a system in place for them.
You got to kill it, Grant.
So, Chief Quinlan, thank you. And I certainly appreciate the work that to support victims, because they certainly don't want to get a runaround when they want to get information. But the other is, I'm really appreciative of the youth services, and especially when I look at some of the numbers of the youth that are engaged in the criminal justice in this kind of criminal justice system, either as victims or as suspects. I will share that they generally are young people of color, and I certainly would like to continue to have conversations with you regarding youth services, certainly as it relates to girls. We know the number of girls that have been involved, either the victim or the suspect, and we want them to have a stronger engagement with a positive engagement with the police. Lastly, I'll make one comment. Certainly Sergeant Ally, who certainly has worked with us, I just have appreciated her insight in working with on behalf of Black girls in the community. And I also want to thank her for working on the Explorers program. I think is an amazing program for our young people. Thank you, Chief. And I also wanted to say, I appreciated your presentation today. It was very informative. Thank you.
Thank you very much. I just want to follow up with 2 quick points. One, we did successfully, even with COVID, deliver an urban lacrosse program this year for young people in our community. And one of the things that I've envisioned under the capital budget, we're looking at a driving pad. One of the things I look at youth service officers being able to do is put teens in a car with a police officer. In that relationship, on a driving pad, where they're maybe teaching them some skills in driving, more than just the little parallel parking course you get through your driver's test. It'll save lives, because we'll give people better skills of maneuvering and handling a car, but it puts that teen next to a police officer in a friendly interaction, and they can talk about some of these obstacles, like, what do I do when I get stopped? Why does an officer do this? And it allows those conversations just one-on-one, and really breaks down those barriers. And I'm really excited about the opportunity to be able to deliver that.
Thank you, Chief. Thank you.
Yes, Council President Harden.
Thank you, Mr. Chairman, and thank you, Chief, for your presentation this afternoon. So as we are having this conversation about reimagining public safety and thinking about where we go from here, you hit on a lot of the themes and really the essence of where we're trying to go. I've tried not to be coy about my vision for reimagining public safety, and it's creating those alternative crisis response units options for specifically mental health calls and calls that may not need armed police officer only, or may not need an armed police officer at all. And so you talked about and I'm trying to look over my numbers because you wrote it down, the crisis response unit. You said currently covers 8% of mental health calls with 7 clinicians. And I wrote down that you said that we're going to add 20 clinicians and it would allow the mobile crisis response unit to cover more. Do we know how much more? Was that based off of anything? Just doing the math, it seems like it will allow us to cover like 30% of those mental health calls, crisis calls. Would you walk down that line around how we got to 20 about and where we go from here as we create that alternative crisis response unit?
Yes, sir. So our current unit is limited to basically 8, 9 a.m. until about midnight. And that's when we find our greatest calls for service, the highest consistency. But there were gaps in there. So the 20, and they were in certain areas of town, the 20 wasn't designed as much around the calls for service coverage as they were designed around being able to provide an on-duty resource 24/7 and always having someone we can use. Now, the reason they're not always going to be able to do a very high volume number is because they're not going to be patrol officers that just jump run to run to run. They may get sent on a run and may be there for hours. They may go get a probate order. They may pink slip, transport to hospital, and then they have follow-ups to do on people that they dealt with yesterday. And they go, and this is the same true for the REACT team with fire. They go and visit them, make sure, did you get your medication? Did you get your doctor visit in? What services do you need? So there's a lot of time spent engaging and building a relationship with these individuals. So when they are in crisis, they see a familiar face, and that's very valuable. So I don't think with 20 clinicians, we still have to identify 20 officers to partner with them, that we will be able to significantly cover the 35,000 calls for people in mental crisis that we receive a year. These will be ones that are more predictable clients that we know are volatile or need medication, and having just an officer who's untrained in CIT or doesn't have a clinician could have a less effective result if they arrive versus letting that clinician appear. We also, I would ideally like to see a clinician in the call center so they could get on the line immediately and be talking to a person while the officer's responding to the scene, which would also allow that relationship to build, to give some de-escalation, to find out if there's weapons involved and communicate that, give them some instructions how to encounter the officer when they arrive. That would make it more important. And I think there's other ways we can utilize those services to get a better result when we're dealing with people in mental crisis.
Thank you, Chief. And again, to the city, to our departments, to our council, and to the community, I want to be very clear that when I think about reimagining public safety, I think that this is a critical point as we look around the country and we see different communities standing up these alternative crisis response, like Eugene, Oregon with the program, like Albuquerque, New Mexico, who has instituted or are working down this path. I think that we're going down that path. And again, I've heard that the themes come out of the department, and I see them in this budget pertaining to public safety. But I look forward to working with you, Chief, and you, Chair, and the department about how we really scale that as we look at the number of calls that may need something like this versus our capacity right now. So just I look forward to working with you in the department on that.
Thank you, sir.
Councilman Remy?
I just want to thank everyone for their presentations today. It's been great to get a better understanding of what the state of the state is. Of course, we keep in constant communication and appreciate the hard work that's gone into this year. You know, we're excited to partner with the chief and certainly with Chief Hap as well, as we look towards what safety looks like for the city of Columbus in the coming years. And so we'll continue this great partnership and look forward to getting through this budget and then what comes next. So appreciate the opportunity to speak. Thank you, Chair.
Thank you, Councilmember. Chief, could you also speak to how the license plate readers with ShotSpotter, how will that enhance their capability?
Okay, very good. So the license plate readers are going to be located in fixed locations in areas where ShotSpotter is also operational. So what happens now is an officer is alerted that a shooting occurred in area X, and they're responding. And a lot of times they just see a car leaving the area and will stop it because they maybe see it with one headlight, say. And that allows, you know, for more indiscriminate interactions with public that may inconvenience and alarm people. This is going to allow us to have leads generated based on the fact that, again, we talk about a small group of youth and young adults engaged in a lot of this gun violence. We can start pinpointing the fact that this vehicle left this area around this time, and out of all the license plates that were captured in these areas, this one appears in 4 of these areas while shooting occurred, and no other license plates were common between all 4 posts. So that gives us a reason to think maybe we can follow up with that individual instead of just blanketly, you know, trying to cast a wide net. We can focus on just those that we know to have been in the area and in multiple areas and have a lead and maybe do some research on them in advance and approach them in a safer situation than doing a traffic stop on the side of the street and walking up on a car that may have just fired, 50 rounds into a house, which is we've seen. And so this provides safer approach and allows for greater solvability by giving detectives actionable information to work off of.
And also, Chief, for you and I guess for Kathy Collins, the value of a records management system for you and for Kathy in regards to the internet connectivity between the two.
Absolutely. This is my number one priority and has been since I took over this position. Officers right now are using a server-based system that has failed multiple times on officers that are trying to engage in just taking a report from someone. It creates frustration for the citizen. It creates enormous delays for officers getting back out and being proactive to respond to more calls for service. So the efficiencies gained by an officer being able to show up and have let's say this would be a cloud-based system. Let's just, for argument's sake, say they use their cell phone. They go in, they enter everything on a cell phone. Right now, they're writing it down on scratch paper. Then they go out to the car and they enter it into the car records management system, which is very hard and cumbersome to use. And then it crashes a lot of times. Then they have to go back to the substation and re-enter all that data just to get it to be accepted. Here, they could go in, they can take a picture of an injury on a person out of domestic violence. It'll automatically be in the case folder. So when they go back out to the car, there's no loss of information. They continue writing their narratives out, and they can share it with the courts immediately because it's all cloud-based. The efficiencies gained, we anticipate being enormous, but it's also about better service to the public and allowing officers to have more proactive time to both engage the public and prevent new crimes.
Administrator Collins, your comments, please.
Yes, thank you, Safety Chair Brown. For licensing, I envision a records management system that we can store and use a database to get all of the documents associated with a record. So right now, when somebody applies for a license, we put certain information in our antiquated database licensing system, but all that paperwork ends up being scanned and put into separate folders that would be, it's overwhelming on time consumption to go in and try to find those if you need a particular piece of paper. To share some of that with the Division of Police would be very helpful, in that we coordinate with the Division of Police on several of the nuisance abatement groups, the massage parlor nuisance abatement group for one, the hotel motel. There's also a liquor abatement group. And so we do have information that would be helpful to them, and they have information that would be helpful to us. So to coordinate those efforts would be of immense help.
Thank you, Kathy. I appreciate it. Again, it's an area we have to utilize technology to our advantage. When it is available to us, it's expensive. ShotSpotter, CAD systems, all those different things. That's applicable for police and for fire. So we just have to stay on top of it, and it's important for my colleagues to be aware of that. If there are no additional questions for Chief Quinlan at this particular time, I'd like to move forward to public speakers. At this time, we'll take additional public comment. I will call the name of the individuals that contacted my office in the order in which they were received. Each speaker will be limited to 3 minutes. Please share your name, address, and any organizations you represent before you begin your statement. And the first individual up who is Mr. Steve Stein, who is the president of the IFF. Steve, your comments, please.
Good evening, Chair Brown, President Harden. Yes, as you said, and per your request, my name is Steve Stein. I'm the president of the Columbus Firefighters Union, and coming to you from 379 West Broad Street, right here in Columbus. Thank you for the hearing, and to all of our partners in administration for their testimony. I would just keep my remarks brief and say that, as our city has stared down the greatest threat to public health and safety in over 100 years, we did not know how many Columbus firefighters would become deathly ill from the novel coronavirus. We did not know how stretched our response capabilities would become. What we did know was that Columbus firefighters would step up without question or hesitation, answer the call, and get the job done. While most of the world was adopting to remote work from home, your firefighters were working around the clock to handle the most complex and labor-intensive emergency medical response in modern history. And while Columbus firefighters have remained focused on fighting this pandemic, we must not lose sight of remaining existential threats to public safety. As Columbus Firefighters Union has consistently stated, we've been far too reliant on suburban agencies and are now faced with even greater challenges maintaining the continuity of care that Columbus residents expect and deserve. We understand that these are complex challenges requiring long-term solutions, and we are confident that the Division of Fire, under the visionary leadership of Chief Happ and his administration, will provide solutions to these challenges through innovation, collaboration, and hard work. In keeping with Mayor Ginther's mandate to realize savings opportunities such that funds can be better spent on enhanced services, this union is in full support of all such avenues of collaboration, including an existing opportunity to expand oversight, accountability, and firefighter safety with respect to the Columbus Division of Fire's special operations capabilities. We look forward to continuing to support the mission of the Division of Fire and thank the administration, this council, and most importantly, the citizens of Columbus for their unwavering support of the best Division of Fire in the United States. Thank you, Chair Brown.
Thank you, Steve. And again, a comment to you and certainly to Chief Happ, an acknowledgement that we went through this whole entire year dealing with COVID, and our firefighters have not had to close down one single fire station, which is spectacular when you consider the sheer volume and potential that exists with regards to that disease. So my hat's off to you, sir, and please pass that along to the firefighters. Also speaking this evening, I have Ms. Lisa Diefendorfer from the downtown city. Lisa, are you available?
I am available. Thanks for the opportunity.
Yes.
As you said, my name is Lisa Diefendiefer. I'm with Capital Crossroads and Discovery Special Improvement Districts. We are downtown at 23 North 4th Street. I just appreciate the opportunity to say a few words tonight. I've been with the SID for, I'm embarrassed to say, over 20 years now, and we've seen a lot happen downtown, obviously over the last 2 decades. And as I said, I'm with the SIDS, and we represent about 780 property owners downtown. Most of you are familiar with us. We invest about $3 million annually in supplemental safety, cleaning, homeless outreach services. We believe in a very holistic approach to addressing issues. And quite honestly, we've been pretty successful at addressing issues over the past several years, thanks to some great collaboration with the community partners and some work that we're just doing on our own too. But as Councilmember Brown, you know, the downtown neighborhood's been alarmed, certainly, about the increase in the number of people on the street who are definitely in crisis. And many of the speakers tonight touched on that and those great needs. But our team is down here every day as well. We see them every day. We're concerned about the ever increasing number of people experiencing homelessness and people suffering from severe mental health issues who are out on the street. This morning, our team found someone right outside the Y who froze to death, who'd been living on the street and just was not able, for whatever reason, to access shelter. We're also alarmed about constant drug dealing and drug use taking place at all hours, particularly in the Long and High area, but in other areas downtown. Repeat offenders are selling drugs to some of the city's most vulnerable people, quite honestly, who are willing to do virtually anything to feed their addiction. And you can see that literally in action on the downtown streets on a daily basis. Just recently, our homeless outreach specialist reported 15 people actively using at a downtown bus stop, and 2 of the individuals were shooting up at the time. And we're consistently seeing people overdosing. We're concerned of these issues, of course. If they're not addressed, they're going to result in an increase in violent crime downtown, and I think that's already sort of begun to happen. And one small business owner, he has a pizza place downtown. He said he feels like people are more scared of downtown now than they are actually of COVID, which is a telling statement, I think. So basically tonight, what I'd like to highlight, and much of this has been highlighted already in Chief Quinlan's remarks, but what we'd like to see, quite honestly, downtown is additional bike officers downtown, and I kind of view them as more community policing officers, that they have the capacity to be a proactive police presence. I don't see that resulting in an increase in arrests or citations. I see it as actually them having an ability to build relationships with folks out on the street and address crises before they even become crises, quite honestly. I know there's been a lot of talk about the mobile crisis response unit tonight, and I will say that downtown would greatly benefit from one, if possible, assigned to downtown. And I would say like 11 a.m. to 7 p. is probably our peak need down here. But we're nervous that we're going to find more people just, have passed away on the street. Honestly, every night we're concerned about that. And then, of course, there was some talk about REACT, and that there's great value in that team, and we appreciate that, and are hopeful that that continues to be funded and expanded. So I just want to say that we appreciate the work that the Division of Police is doing in our community, certainly, and we are hopeful that we can receive some increased support around enforcement, but we also recognize that a lot of it needs to be tied into the provision of social services too, and there's great value, because what works for one individual might not work for another individual. We just don't want people dying out on the street, quite honestly. So thank you for listening to my suggestions and testimony and perspective today. And if you have questions, I'm certainly happy to answer them as well.
I don't have any questions, Lisa. I would simply say that I know Chief Quinlan is aware of the concerns that you've expressed, and we will, within this budget, do what we can to try and address those concerns. I consider downtown a neighborhood, and we've got to make sure that you're getting the right response for the given circumstance. And we'll get an opportunity to discuss that with the commander who has that area of responsibility. So thank you.
Thank you.
Also, tonight we have Sheila Eubanks. Ms. Eubanks, are you available?
Angie's having an issue. We're having some technical difficulties. We'll be back in a second.
Okay, Angie, if we can't get Mrs. Eubanks, can we move on?
Sorry, she said her system shut down, so she'll be back in a second.
For those, apparently we've had some technical difficulties. Just a few moments to let Angie work her magic. In light of what we just heard from Lisa, I do have concerns about individuals freezing to death. Our weather obviously has changed. We have to be far more sensitive so that doesn't happen. We're going to have to spend some time and take a look at that in discussions with Chief Quinlan. And I believe that Commander Weir has that area of responsibility from a police standpoint, but that's not going to solve the issue. We got to figure out some other way to be concerned about that. And we'll discuss that with Lisa in much more detail.
Certainly, certainly. And we started hearing pieces of that or some of that when we held our downtown community conversation a few weeks ago, Mr. Chairman. There are real concerns around safety, mental health issues, and just a lack of traffic downtown. It seems we just got to put some attention there around safety. And I know that your office has been engaged post those meetings.
Yes, I did have that some conversations along those lines. Again, I think of downtown as a neighborhood. We just have to figure out a way to make it more reasonable for folks, especially in the late evening hours, who are downtown. I don't know what the answer is unequivocally, but we got good people around us with fire and police and the community shelter. I mean, we don't want anybody freezing to death in the city of Columbus. That's just unacceptable. So we have our work cut out for us. This particular budget, I think, Council President, does address the concerns for expansion to some degree in the sense of what the capabilities are with regards to our division of police. Again, it's another one of those issues where you said we cannot enforce our way out of this problem. We just have to make sure that we have the appropriate people respond.
Most definitely. Mr. Chairman, is it just me or did we lose Miss Angie altogether?
Yeah,
We did. Her system shut down. She'll be back in a moment.
her system shut down and we did lose her. She's trying to get back in.
Yeah,
Got it.
Mark is working on getting it fixed.
All right.
Council President, again, for you, from a progressive perspective involving police and fire, when we do talk about the REACT vehicles and their response capabilities and the importance of that, you've heard from the chief of police discuss issues with regards to more body-worn cameras being applied to different units, which is significant, but it gets into the cost because of storage space and how they do that. And on the fire side, with our, again, the mobile stroke treatment unit, as you remember, again, it is so imperative that the response is given the right information so they get that unit to respond rather than just a regular EMS fire response vehicle. We can get the stroke unit there based on the analysis by the dispatchers. Again, sending the right response unit to that particular problem is really significant. And both divisions have done a super job of improving in that area, and we're going to continue to put pressure on them to do even more.
Yes, thank you.
Yes.
I really do believe that this budget in particular lays the foundation for a progressive reform of how we think about public safety. I think that I think that it really does lay the groundwork, and I think that we have to do we have to do a good job telling the story of where we're trying to go. And I think that I think the Chief did a good job of starting that story this evening. And again, for me, I want to be very open about where the vision that we have in terms of reimagining public safety. It's about giving those residents that alternative and making sure we have the infrastructure. And that's why I'm really appreciative that the mayor put in money for the Adam H call center, our response center, because I think we need that back house infrastructure too on the health side as well. So like I said, I look forward, and all of these changes, none of them happen in 1 year, in one budget. These are multi-year conversations and multi-budget conversations. So we look forward to those.
Council President, you're 100% accurate. And again, things aren't going to go away. It's just a realization of how aggressive we are being able to deal with prevention, as well as our ability to react to the situations that are at hand. Again, I cannot underemphasize the resources that are necessary for our fire division to do the work that they do. We got 150 homicides, and I feel confident in saying if it weren't for their rapid response and, again, our EMS systems, we'd have more than 150 homicides. So providing them with the tools that they need is really, really special. And the relationship, again, that they have with our police division is unique, believe me, in a lot of different ways around this country. Divisions of police and divisions of fire don't always work as in sync as ours does, which is really, really important. And I cannot commend them enough for the way in which they're trying to do that.
I would agree with that. Mr. Chair, do you know how many more public speakers we have?
I have 3 more. Sounds good. But I'm not sure if they're going to be able to make them on tonight.
That's what I was thinking. Maybe we could follow up with written responses to their questions or something like that.
We're good. I actually have it figured out. We're good to go. Councilmember Brown, who's the next person on your list?
Sheila Eubanks.
Yes, let me find Miss Eubanks here. I would unmute her. It's not allowing. Hey, Angie, it's not allowing me to unmute. Can you ask for President Harden for me?
President Harden.
I think he stepped away, Angie. Hey, Angie, he's just going to close.
I'm going to close out to my colleagues and to members of the community due to some of the technical difficulties that we're having right now. So in closing, but I would say to any member of the community that they could feel free to contact my office at 614-645-8210 or 614-645-4605 for additional commentary. Again, I'd like to thank my fellow council members and Mayor Ginther, Auditor Kilgore, City Attorney Klein, Finance Director Joe Lombardi, and Public Safety Director Ned Pettis for their leadership in this budget process. In addition, I would like to recognize Deputy Director Dan Giangardella and the Mayor Ginther's Deputy Chief of Staff, Kate Bisciotti, Mr. Echo Dennis, and the entire Department of Public Safety staff for their role in the budget process. I would also like to thank Interim Fire Chief Happ, Administrator Collins, and Police Chief Quinlan for their presentation this afternoon. They were very, very precise and very comprehensive. I'd like to thank my staff, Denise Friend Foster, John Oswald, and Grant Ames for their assistance in preparing for this afternoon's hearing. And I'd like to extend a special thank you to Angie Blevins, or Clerk Blevins, and Angie Burks. She's working her magic with regards to technology. Her technical acumen is above reproach. So if it's not working out, there's something really going on. And finally, I'd like to thank the community for their engagement in today's proceedings. Upon conclusion of today's hearings, I, along with my fellow council members, will review the public safety budget in detail. And I trust that Director Pettis, Chief Happ, Chief Quinlan, and Administrator Collins will make themselves available in the future for any questions that citizens may have. Again, thank you, everyone. And again, Chief Happ, Chief Quinlan, again, to all of the first responders, from City Council, a sincere and heartfelt thank you for what you do every single day for the citizens of the City of Columbus. Take care and good night, everyone.
Thank you, Chair Brown.
Chair Brown.
Thank you.
Thank you, sir.
Thank you.